Good evening. Sorry. Okay. Good evening, ladies and gentlemen. So I would like to welcome you all to this forum discussion. Before we proceed, let me introduce myself. So my name is Juris Nur Hafiza, and I will be the moderator for the program today. So first of all, I would like to give some brief introduction on Hall of Aspire. So Hall of Aspire is organized by Altruistic Malaysia. Hall of Aspire, we are essential in a process giving all people access to knowledge and information. This platform needed more than ever in digital days. Most importantly, Hall of Aspire are the places where you can find critical topics or causes that need to be discussed nowadays. So the topic varies by the action that need to be taken. For example, for peace, education, environment, health, humanitarian. I'm so sorry, and economy. So today we will discuss title practice that hurt dislikes. Wait, I'm sorry. Okay, wait. So today we will discuss titles Stigma and Prevention of HIV and AIDS. So this forum aims to raise the awareness about the global solidarity and shared responsibility on the global health responses, including the HIV or AIDS response in a new way. The best we can do to prevent this disease from spreading and taking more life is to educate and create awareness. So this will help people to become aware of the levels of care and treatment, whether they are living with HIV or AIDS or caring for someone with this disease. It requires the world to come together, leaving people behind. So leaving people behind is not an option if we are to succeed. Eliminating stigma and discrimination, putting people at the center and grounding our responses in human rights and gender-responsive approaches are the key to end the colliding endemic of HIV/AIDS. So statistics shows mainly women between 18 and 40, the age of 18 and 40, and men between the age of 30 and 50 are the ones who are mostly infected with this disease. With a professional and experienced panelist that we have tonight, this forum is set to discuss on the stigma and prevention of HIV and AIDS. So, wait, yeah. So we have three speakers from class actually. The first one is Mr. Rafi, right? If I'm not mistaken. Okay, so we have Mr. Rafi, and then we have Mr. Adam. No, Mr. Alif. I'm so sorry. Okay, and then we have Mr. Pitaloma. Okay. So I'm gonna introduce a bit about our speakers. So firstly is Mr. Rafi. So Mr. Rafi is actually a medical graduate who is working as an outreach worker at class, helping clients with sex health issues. So he has organized and presented talks with various organizations regarding the sexual health. And then we have Mr. Alif. So Mr. Alif is also a part of class. He is an education for art and design graduate who is working as an outreach worker also at class, helping clients with sex health issues. And he has background in teaching and tutoring and has been involved in various events regarding sexual health and religiously promoting safe sex to the masses. I'm sorry if there's any background noises, yeah. Okay, and then the last one is Mr. Pitaloma. So the name is quite unique, right? Okay, so Mr. Pitaloma is actually an undergraduate student from University Tun Abdul Razak, UNITAR, with the background study of government and public policy, whom is also working as an outreach worker at class. So he also actively spread awareness regarding sexual health and safe sex through social media platforms like TikTok and Instagram. So, without further ado, I will pass the floor to the three handsomest panelists for tonight.
Thank you so much, Juris. You're being so nice to us. Thank you for having us here. So yeah, me, Shah, and Alif, we've been working for class for quite some time, and all of us are outreach workers, which means that we we establish contact with our clients, clients who are at a high risk of getting sexually transmitted infections, and we provide them commodities such as condoms and linkage to care for them to either prevent themselves from getting STIs or treat STIs that they have. So before I go into our slides, I would just like to talk about CLAS. So CLAS is Kuala Lumpur Export Services Society. We've been around for 20 years, since 2001. And our main mission since our establishment was to eliminate AIDS in Malaysia. And just besides AIDS, we also work a lot with STIs as well. And recently, we've been working with some counselors to provide free counseling services at class. And we also have a support group, a shelter home in which we house about around 6 to 7 people who are at the end stage of HIV, which is AIDS, and we help them with getting their treatment at Hospital Sungai Buloh. So that's basically what we do. There's a few more services that I didn't mention, but mostly we are helping clients who are at high risk of sexually transmitted infections, and we try to help them to reduce those risks, or if they already get these diseases, for them to get treated for it. And so, as the team mentioned just now, it's global solidarity, shared responsibility. So it basically means that global solidarity, it means that the whole world has to unite together for this shared responsibility. And we can see in the case of COVID, where countries didn't work with each other to stop the spread of infection. So the importance of having this global solidarity is that when there are pandemics or endemics with this infectious diseases, countries and people in those countries need to work together to curb the spread of this infection. And even the viewers, I mean, maybe most of you are not at risk for HIV or STI, but just having the knowledge of HIV and STI would be a great help to reduce the risk of other people getting HIV and STI. Maybe you can educate your children about sexual health or give support to someone who is HIV positive. All right, so that's all for the introduction. I will now move on to my slides, which is I'll be talking about sexually transmitted infections, and Alif and Loma will be talking about HIV, which is a very huge topic. So I'll quickly go through sexually transmitted infections, and I'll start with viral infections. So there are several types of infections that affect people sexually. They are transmitted sexually. And some of these are viruses, some of these are bacteria, and some of these are parasites. So we'll be talking about the viruses first. And the first virus we'll be talking about is herpes. And herpes has two ways of infecting us, either oral herpes or genital herpes. So oral herpes is caused by this virus called herpes simplex virus 1, HSV1, whereas genital herpes is HSV2. So with every single virus, dengan semua jenis kuman, any virus, bacteria, even COVID, it has an incubation period. So from the moment you first get the bacteria or the virus until the moment where you show symptoms. So for example, with COVID, the incubation period is 2 weeks. So you 5 days to 2 weeks. So you may get the virus today, but only within 2 weeks you'll get the symptoms of cough, runny nose, headache. So The incubation period for oral herpes is 20 days. And the first symptom that will appear after getting infected with herpes is a cold sore. So if you can see in those pictures, they are these sores that are located at the corner of the lip, just in between the skin and the lip. So this is quite specific for oral herpes. Some people they may get zits on their face, but with herpes it's very um, exact the location. It's right in between the skin and the lip. So the cold sore it will be very itchy and painful, and it's contagious. So if, for example, if when someone has a cold sore and they kiss their partner or they share drinks with their partner or they have oral sex with them, they can transmit the herpes virus as long as the sore is still there. Tapi kalau dah hilang, if the cold sore is it cracks over and it's healed, then the person won't transmit the infection to other people. So um, if someone has the cold sore, they should get treatment because we do have creams and oral medication available to treat this cold sore. So for herpes, the treatment is acyclovir, an antiviral. You know how we have antibiotics for bacteria? For viruses, we have antivirals. And for herpes, it's acyclovir. So for someone who has oral herpes, they should go to a doctor and the doctor will give them this cream that they can apply on their cold sore. And yeah, the cold sore will go away faster after that. So herpes can never be, it cannot be cured, but it can be treated every time someone has symptoms. So the next one is genital herpes. So it's still herpes, but this is herpes simplex virus 2. And it affects the genitals. So it can affect penis, vagina, or anus. And the incubation period for genital herpes is 4 days. So after, for example, you have sex with the person on today, only 4 days later you will get the symptoms. And the symptoms are itchy, painful vesicles. So if you can see in those pictures, there are these bumps on the penis, on the anus. So these bumps are filled with clear fluid, cecair yang jernih ada dalam timbulan-timbulan tu. And this clear fluid has the herpes virus inside it. So when someone has these vesicles and they have sex with other people, then they are contagious to other people. So as long as those vesicles are still there, but after 2 to 4 weeks, the vesicles will break and they will become ulcers, and they will heal itself. So same like oral herpes, genital herpes. Um, After its incubation period, the symptoms will show, but after a while, the symptoms will disappear. But when the symptoms disappear, it does not mean that the virus has disappeared. The virus will sleep in your body. And when your immune system is weak, the virus will come back up. So what happens when the virus manifests itself? So you should get treatment. It's the same medication as oral herpes. It's acyclovir, uh, taken either by in the form of a cream orally or by injecting into your veins. So yeah, same as oral herpes, this is not curable, but it is treatable. And when the person is treated, then they won't be contagious to other people. So it's important to get treated when you have the symptoms. Okay, that's all for herpes. Now we'll be talking about genital warts, ataupun ketuat kelamin. So genital warts is the most common STI in the world, most common STI in Malaysia and everywhere else in the world. So ketuat kelamin ni yang paling common, STI yang paling common sekali lah. And the incubation period for human papillomavirus is about 1 month to 20 months. So for some people, the symptoms appear earlier, but for some people, it appears much later, maybe up to 20 months. And the symptoms would be ketuat-ketuat ni lah. So these warts will grow on the sites that are affected, either on the penis, the anus, or vagina. And there will be painless lumps. Unlike herpes, herpes is quite itchy and it's quite painful. But for HPV, for the genital warts, they are painless. Right? So it's just a lump that exists there, and it can be transmitted by sex or sharing sex toys. So the treatment is okay. So same like herpes, HPV is not curable. Kita boleh rawat, tapi kita tak boleh nak sembuhkan. So when a person has the genital wart, just skin to skin contact with the genital wart can transmit the infection. So what to do? So if someone has the wart, they have to get rid of the wart. By removing the wart, they will not infect their partner. So to protect your partner, remove the warts. And you can there's a lot of ways to remove it. Either you can freeze it, laser it, put some toxic cream on it, or by surgery, just cutting it out. And yeah, as written there, it can remove the warts and stop the infection from being passed on. And one good thing about HPV is that we have vaccination for it. If you know, in Malaysia, high school girls, only females get this vaccination. So they get this vaccination in high school because HPV can cause cervical cancer in women, but men do not get it. So for people who don't have the vaccination, you can go to some private clinics that provide it. It's about 700 ringgit for the vaccination. It's like three jabs in about 6 months. So yeah, each appointment would cost about 200 plus. So yeah, but the important point is that there is vaccination available. HPV can be prevented. Okay. The next one is viral hepatitis. So hepatitis is keradangan hati. It is a condition where your liver is inflamed due to various reasons. So now we're going to talk about viral hepatitis. So two viral hepatitis that are transmitted sexually are hepatitis B and hepatitis C. There's a bit of difference between hepatitis B and C, but there's a lot of similarities as well because both of these viruses, they affect your liver. So some of the symptoms overlap, are quite similar. So for hepatitis B, the incubation period is 4 months. And the symptoms are quite general, like fever, fatigue, nausea, appetite loss, abdominal pain, tea-colored urine or dark urine, and clay stool. So a pale stool. Yeah. And it can be transmitted through sex and by sharing needles. So for example, injecting drug users, if they share the same needles and one of them is positive for hepatitis B, then they can transmit the hepatitis B to the negative person. And so hepatitis B is not, if someone has chronic hepatitis C, it is not curable, but we can still give medication to slow the progress of the disease. And they can live for quite long actually. For people who have chronic hepatitis B, they can live up to 60, 70 years old if they take their medications properly. So what we give is that we give antivirals to them, and these antivirals will halt the progression of the disease and slow the liver damage. And same like HPV, hepatitis B also has vaccination available. I think babies in Malaysia, at 1 month, they get hepatitis B vaccination. But the vaccination is not, the protection of the vaccination is not lifelong. So maybe after 15 to 30 years, you need a booster shot for hepatitis B. Yeah. The next one is hepatitis C. Oh, wait, before that, I just want to talk about the distribution of hepatitis B across the world. If you can see the areas where it's dark blue, that's where there's a lot of cases of hepatitis B. Yang biru muda sikit, the lighter blue, you have less cases. And yeah, other places they have like very they don't have that many cases. So over here you can see that Malaysia is dark blue, so it is endemic to our region. So that's why every Malaysian is vaccinated at birth. Next one, please. All right. So hepatitis C is quite similar to hepatitis B, but there's a lot of differences as well. So the incubation period is about 2 weeks to 6 months, whereas the symptoms are that people can, because of the liver damage, people bleed easily and they bruise easily. So maybe it's just a minor injury. They hit their foot against the bed, but the bruise is quite big because they don't have like their blood cannot clot well. So yeah, they bleed easily, they bruise easily, they get tired easily, they don't have much appetite. Jaundice. So jaundice is a condition where their eyes and skin turn yellow. And then they may have dark urine, itchy skin, and ascites. So ascites ni kembung perut. So their stomach, their tummy is distended. Yeah, because of hepatitis C. So most of hepatitis C is transmitted through needle sharing, but it can also be transmitted via sex. And the treatment for it is different from hepatitis B. So we use direct acting antivirals for hepatitis C. So to make it clear here, hepatitis C can be cured. Unlike hepatitis B, so hepatitis B has vaccine but cannot be cured. Hepatitis C doesn't have a vaccine but can be cured. All right. Yeah, you can go to the next slide. All right. So that is all that we're going to talk about viral STIs. Now we'll go to the bacteria that cause STI. And the most common one that we find in Malaysia is gonorrhea. So next slide, please. So gonorrhea is quite popular in Malaysia for people who are sexually active and they don't use condoms. They may get infected with gonorrhea. So the incubation period is quite fast. It's about 2 to 8 days. So you may have unprotected sex today, and within 2 to 3 days, you already have the symptoms. And the symptoms are painful urination. There's a fluid that comes out of your genital, so it's like a pus-like discharge. And if this condition is not treated, then the disease can climb up to your other reproductive organs, maybe to the testes or to the ovaries, and cause testicular pain and swelling, or ovarian pain or swelling. And when this happens, that it can cause a person to be infertile, jadi tak subur. So it will be hard for them to conceive and make babies because their reproductive organs are affected by this infection. So it would be good for a person to get treated as soon as possible as you get the infection. So just to make it clear, the symptoms are painful urination and pus-like discharge, or maybe in Malay, kencing pedih, nanah keluar daripada zakar ataupun daripada alat kemaluan yang lain. And the transmission is sex, either anal or vaginal sex, and oral sex can also transmit gonorrhea, especially for the person who receives the oral sex instead of the person who gives. Yeah, it's the receiver instead of the giver that is at higher risk of getting gonorrhea. And the treatment is quite easy because it is very treatable. Just one injection is enough to cure the infection. So we just give one injection of ceftriaxone, an antibiotic, and within 1 to 2 weeks, they can have sex again. But we would advise them to not have sex for 1 to 2 weeks. But even after that, do have sex in a protected manner. Protect yourself and your partner. And if you see the pictures, the picture of the penis, you can see there is pus coming out of the penis. And then next to the penis is the vagina. The vagina is inflamed because of gonorrhea. And above that is a picture of gonorrhea infection in the throat. So it's called, gonorrhea infection in the throat. And you can see the throat is inflamed and it's quite red. And on the right side, if you see the baby's eyes are infected and they are closed. And the baby is blind actually. Baby tu buta because the mother had gonorrhea, and while giving birth, the baby got infected with the gonorrhea from the mother, and then this can cause blindness. So that's why it's very important for mothers to get tested and treated for STI, so it's not passed on to their babies. Next slide, please. The next bacterial STI we'll be talking about is chlamydia. So chlamydia, the symptoms are quite similar to gonorrhea, but there is some slight differences. So the incubation period for chlamydia is 7 to 21 days. And the symptoms, like gonorrhea, is painful urination, clear discharge, and testicular or ovarian pain and swelling. So kencing pedih, ada cecair keluar daripada zakar, dan ovary tak pun testis bengkak. Dan ini boleh menyebabkan ketidaksuburan dan nanti susah nak dapat baby sebab the infection has spread to your reproductive organs. So basically it's same as gonorrhea. It's good to get treated as early as possible so that the disease doesn't spread, doesn't cause you to have infertility or you don't infect other people. And the transmission is similar. It's anal sex, vaginal sex, or oral sex. The treatment is different. The treatment is oral antibiotic. Instead of injecting antibiotic, the treatment here is oral antibiotic, either azithromycin or doxycycline. So chlamydia and gonorrhea are easily treatable with antibiotics. And if you see the pictures there, at the penis, there's some clear discharge coming out of the penis. Like gonorrhea just now, the discharge is usually pus-like. It's kind of yellowish, whitish color. But with chlamydia, it's a clear discharge. And you can see there's that the person has oral chlamydia at the top. All right. Next slide, please. Okay, so now we'll be talking about syphilis. So syphilis has been a major problem throughout the world, especially in the early 1900s before the advent of antibiotics. But now, syphilis is not a major, it's not as big problem as it was before because we have antibiotics that can treat syphilis. And it has several stages, primary, secondary, and tertiary. Between secondary and tertiary, we have a latent stage, which is like a quiet stage. It doesn't have any symptoms. So we'll start talking about primary first. So for a person who's infected with syphilis, the incubation period is about 10 to 90 days. And the first symptom that they will encounter is they will see an ulcer. So the ulcer can be present at their genital parts or in their oral cavity. So either on your penis or vagina or around your anus or in your mouth. And this ulcer is not painful. It's a painless ulcer. It's a painless ulcer and it will go away by itself. Dia akan hilang sendiri. Tak buat apa-apa pun dia akan hilang sendiri. But when it goes away by itself, it doesn't mean that the infection is cured. The infection is still there, but the bacteria is replicating inside your body. And after 6 months, about 6 months after the primary stage, it can progress into the secondary syphilis, in which most people with secondary syphilis, they will have rashes. They kind of ruam. They will have rashes on their palms, on the soles of their feet, or on their body. And the next stage is the latent stage. In between secondary and tertiary, we have a latent stage. So in latent stage, there are no symptoms. So there's no symptoms here, but the syphilis is actively replicating in your body. And after 3 to 13 years, it can progress into tertiary syphilis. So tertiary syphilis is very serious because it can cause death and it can cause a lot of organ damage. It can affect almost every single organ in your body. It can affect your skin, it can affect your eyes, affect your liver, your bones, your heart. So yeah, it's a very damaging stage of syphilis. But throughout this stage, we can still give the antibiotics. So the antibiotics is benzyl penicillin, and we give 3 injections. So if the person starts treatment today, the second injection will be 1 week from now. The third injection will be 2 weeks later. So 3 injections within 3 weeks will cure syphilis. Right. So that is all about syphilis. The last STI I will be talking about before Alif and Shah talk about HIV is I'll be talking about scabies. Scabies is a parasite, so it's not a bacteria, it's not a virus, it's a parasite. It's so the parasite, the vector for the parasite is Scabiei hominis, which is a mite, and the symptom for scabies is that people will have raised bumps on their skin. So either on the palms of their hand, any place that's quite wet, that's quite wet and damp and warm. So it could be your genitals or your palms and your feet. So the treatment, the transmission for scabies is prolonged skin-to-skin contact. So a lot of scabies is transmitted through sex. People usually call it crabs as a layman term. So yeah, crabs is transmitted through sex, but it can also be transmitted by prolonged skin-to-skin contact. So for example, at the child nursery, the carer takes care of the baby. They hold the baby for a long time. If the carer has scabies, they can transmit the scabies to the babies. Or maybe boys or girls living in anyone between living in a dormitory, duduk dekat dorm, orang lain ada scabies, dia pun boleh dapat scabies juga. So any prolonged skin-to-skin contact can transmit scabies. But the treatment is quite easy. We give them oral antiparasitic medications, which is oral ivermectin, and we also need to give them this chemical, benzyl benzoate or permethrin. And these things will ask them to wash their sheets, wash their clothes with it, so to kill the scabies that's in their sheets or clothes. So take the oral medication, wash your sheets and clothes, dry them under the sun, And then, that will be the treatment for scabies. So that is the last slide representing today. No, sorry. Next slide, please. Yes. So those are all the STDs that I'll be talking about today. But getting an STD is not the end. A lot of them are curable, and all of them are treatable. Like I said just now, like a lot of all the bacterial STIs are curable, and hepatitis C is curable as well. But hepatitis B, herpes, and HIV, they are not curable, but they are all treatable. They all have medications to slow the progression of the disease, so that people can live healthily. So for people who don't, for everyone, STDs are preventable, and there are steps that you can take to protect yourself and your partner. So these are some ways that you can do to prevent yourself from getting STDs. So a good way to do it is to have fewer partners. So for example, if you only have one sex partner, you know their status, and they don't have any STDs, STIs, and neither do you. So, and you're having sex with each other. Even when you're having sex, when you're having condomless sex, there's no risk for STI because neither of you have STI. But when you have more partners and you practice unprotected sex, then the probability of getting STI will be higher. And after that, you can also use condoms. Condoms is a very effective way to avoid STD. It's one of the most effective ways that we know to avoid STD, is besides abstinence or having fewer partners. But you have to use the condoms correctly. I'll talk to you how to use the condom correctly after this. Besides that, you can also get vaccinated for some STIs like hepatitis B and HPV. Vaccinations are available for both of these to protect us. So this is how to put on and take off a male condom. So there are female condoms as well, but male condoms are more popular to be used. So first of all, before you open the packaging, do look at the expiration date. Each package has an expiration date. So if it's not expired, then you can use it. If it's expired, do not use it because it can break easily. Push the condom to the side and open the packaging carefully. Make sure the penis is hard before putting on the condom. And if you know, at the end of the condom, there's a bubbly part. Ada gelembung kat hujung condom tu. You have to push out the air. So pinch the end of the condom and then roll the condom on your erect penis. So make sure there are no bubbles inside. If there are any air inside, then there's higher chance for the condom to break. And then when you have sex, do remember to use water-based lubricants instead of oil-based lubricants. So water-based lubricants are like KY jelly, Durex, or even silicone lube is fine. They're okay with condoms. But oil-based lubricants such as baby oil, lotion, or Vaseline, this all can dissolve the condom. They can cause the condom to break. So yeah, use water-based lubricants and use a lot of lubricant so that the condom doesn't tear. And when you pull the condom out, make sure to hold the base so there's no spillage, and tie it up and throw it away safely. And that is all from me. Thank you for listening. So I'll pass the floor to Pitaloma.
Alright, thank you, Ralph. So, hi guys, I am Peter Loma. So, as for my part, I akan terangkan lebih lanjut lah apa itu HIV. So, as for my part also, I akan talk in dua bahasa so that kita semua boleh dapat faham dengan lebih jelas dan lebih mudah untuk fahami. So, what is HIV? Apa itu HIV? HIV is Human Immune Deficiency Virus lah. So, from the name itself, kita dah boleh kita dah boleh tafsir dah apa benda virus ni. So, seperti yang kita tahu, immune system is what that protects our body and also fight for our body from any penyakit, tak salah demam ke apa ke, dia lah yang bekerja sebagai pelindung and also melawan penyakit yang nak datang serang kita. So HIV is the virus that yang melemahkan immune system badan kita. So to make it turns to an analogy lah, untuk jadikan dia sebuah cerita, back in the old ages kan, sometimes there will be like a castle, and then there will be king. So around the territory akan ada like wall kan. So kita anggap wall tu like our immune system. Kita anggap wall tu is the immune system. So the wall and the border is our immune system, and then we have the enemy yang nak dengan ada niat nak datang menyerang tu, kita anggap dia as any opportunistic diseases or any dari salah demam ke apa-apa bakteria jahat. And also there is a spy dalam the territory tu sendiri, which is the HIV. Kita anggap spy ni as HIV lah. Dia menyamar jadi orang dalam and orang pun tak tahu yang dia ni adalah HIV. So macam mana HIV ni dia bekerja, how it works is actually dari dia menyamar tu sendiri, dia akan attack dari dalam, dia akan attack the border, dia akan attack our wall tu, and so that our wall will be like semakin lemah, and if let's say from the council itself tak ambil apa-apa inisiatif untuk lawan ataupun untuk if let's say in a human way untuk take treatment, so bila virus tu keep on lawan and the border will keep on runtuh, berlubang dan sebagainya, semakin banyaklah ruang dan peluang untuk our enemy to come attack our body ataupun attack the territory. So this is how the HIV works like, and this is how the HIV melemahkan our wall ataupun immune system kita. So to talk more about HIV, so HIV ni adalah apa yang causes to AIDS lah. HIV is what to just now up again. Sorry. Okay. So the first one is HIV is what that causes the AIDS. So if let's say seseorang yang terinfected with HIV and dia tak on treatment, dia tak buat blood test, dia tak tahu yang dia HIV positive and dia biarkan macam tu saja. So if let's say he or she is not on treatment, lama-kelamaan dia boleh pergi ke arah AIDS. AIDS ni nanti kita akan terang apa itu AIDS. So the second thing is that HIV, this virus can only live and be transmitted through humans lah. So tak ada, jangan cakap nanti you dapat HIV daripada anjing ke, daripada tumbuh-tumbuhan ke, no lah. Sebab HIV can only transmitted from human to human. And also the third part is HIV is what that weakens the immune system, that making our immune system to be vulnerable to infection and also tumors. So ini apa yang cakap tadi lah, bila the HIV virus lemahkan our immune system, kita akan lebih terdedah, we are more fragile, we are more vulnerable to any opportunistic diseases and also any kind of disease. So next slide. Alright, so tadi kita cakap kan on the first option, kita cakap HIV adalah what that cause to AIDS. So apa tu AIDS? AIDS is acquired immune deficiency syndrome. Syndrome di mana our immune system tu dah sangat lemah ataupun almost ketiadaan lah, as what you can see in the slide. So macam mana boleh dapat AIDS ni? Macam I cakap tadi on the first option from the previous slide. If let's say one person dia dapat HIV, okay, and dia tak sedar dia ada HIV, yang tu kita akan terangkan nanti macam mana orang boleh tak sedar dia ada HIV. So when he himself or she herself doesn't even realize that she got one, and dia biarkan macam tu saja, and dia tak ada apa-apa symptom, and the HIV actually can develop and turn into AIDS from 1 to 10 years, and it depends on people lah, sebab every people ada dia punya immune system, kekuatan immune system yang tersendiri. So depends on people. Usually AIDS akan develop within 1 to 10 years after HIV is not treated. Alright, so kita dah tahu apa tu HIV, kita dah tahu apa tu AIDS. So kita nak tahu how can a person get HIV? Macam mana seseorang tu boleh dapat HIV? Dari udara ke macam COVID? So kat sini kita akan belajar and cuba tahu pasal macam mana orang boleh dapat HIV. So the first thing is through sex without condom lah, ataupun seks tidak selamat. So sebab tu in class kita always inform our client, always practice safe sex, and also always wearing condom. Sebab apa? Condom ni adalah one of the most effective way untuk kita prevent daripada HIV. Sebab kalau nak ambil PrEP macam mahal kan, so condom is one of the most effective way untuk kita cegah daripada HIV, and also by having a safe sex lah. So now kita dah tahu sex without condom ataupun seks tidak selamat adalah apa yang menyebabkan seseorang tu boleh dapat HIV. So the second thing is pass from mother to baby lah. One of the thing is from susu ibu. So and another thing is when the mother is positive and then dia tak sedar yang dia tu positif, dia lahirkan pula secara normal. So this is what makes the baby to get high chances untuk the baby to be positive as well. So usually bila ibu tu mengandung, usually disarankanlah mereka akan buat HIV test dulu, and if let's say seibu mengandung tu dia HIV positif, so right after 12 week after dia disahkan mengandung, so right after dia 12 week of mengandung tu, dia disarankan untuk ambil ubat had lah. Ubat had tu nanti kita cerita selepas ni. So dia perlu ambil ubat had sampailah dia beranak, sampailah dia lepas beranak sekalipun. So as for the baby, after dia dah deliver the baby also need to take had for 1 month. Yeah, about 1 month. And also sebaiknya the proses untuk beranak tu sebaiknya dibuat secara caesar and not by normal lah, supaya kita dapat rendahkan risiko from the baby to get one too. And the third option here, kita boleh tengok how can a person get HIV is through sharing injecting equipment. This is of course lah, sebab like for drug users kan. So if let's say lah kan kita sharing needles, so for sure lah needles tu dah masuk dalam capillary darah you, lepas tu you cabut, you masuk pula capillary darah orang lain. So for sure lah benda tu senang untuk transmit. Sebab apa? HIV ni paling senang dia nak transmit from blood to blood. So that is why sharing injecting equipment ni sangat tinggi chances untuk seseorang tu terinfect dengan HIV virus. And the last one is through contaminated blood transfusion and also organ transplant, melalui pendermaan darah and also pendermaan organ. Tapi in Malaysia dah sangat kurang lah kes ni. Sebab apa? Bila seseorang tu nak derma darah, of course lah pekerja tu akan the staff will filter dulu sama ada dia akan bagi borang, dia nak tahu kesihatan diri you, macam mana lifestyle you. So dia akan ada certain soalan. And also bila you dah derma darah, if let's say you tak tahu pun you HIV positive, so you dah terderma darah tu, don't worry, sebab memang diorang akan buat check at the lab lah for several, not only HIV but also for several thing as well. So you don't need to feel like takut ke apa, sebab nanti dekat sana memang diorang akan buat double screening. So sebab tu juga dah kurang kes berkenaan dengan contaminated blood due to blood transfusion. Alright, so next kita nak tahu dekat mana virus ni berada, ataupun from the highest concentration, dekat mana virus ni paling tinggi sekali concentration dia, dekat mana. So the first thing first dekat blood lah. Of course tadi kita dah cerita pasal the injecting sharing needles. So of course the first one, dia paling tinggi concentration of this HIV virus is at blood. So dekat blood ni sangat tinggi dia punya konsentrasi virus. And then kedua dekat semen ataupun air mani. And the ketiga paling banyak concentration adalah dekat precum lah ataupun air mazi. And then the vagina ataupun rectal secretion. And last one is the susu ibu. So this one kalau kita tengok dari segi diagram tadi, gambar tadi. Kita tengok balik gambar tadi, boleh? Bawah satu. Okay tak. Where is the virus? Yep. Okay, tak apa. So, I think I skip one kan? Okay, I'm so sorry. I skip one, I think. Okay, tak apa. Kita ulang balik. Alright, so tadi kita dah tengok how can a person get in HIV virus, right? So, right now kita akan cuba tahu macam mana seseorang tu, kita kena tahu juga macam seseorang tu tak akan boleh dapat HIV daripada mana. Ni penting juga sebab ini yang contribute to stigma and discrimination pada masyarakat luar, kerana orang tak tahu, kalau sentuh boleh terkena HIV. Kalau pegang dia takut terkena HIV and so on. So ini adalah apa yang masyarakat kat luar sana perlu tahu supaya kita dapat hentikan stigma kepada mereka yang hidup dengan HIV ni. So the first thing is you takkan boleh dapat HIV melalui kissing, okay? Kalau you cium ke apa, through alio ke, you takkan terinfect dengan virus tu lah. And the second thing is from hugging. So you tak ada masalah lah untuk ibu yang ada HIV positif ataupun ibu yang PL-HIV untuk peluk anak dia ke, peluk suami dia yang non PL-HIV, boleh saja. Dia takkan berjangkit. Sebab apa? Kita kena tengok balik dekat where's the virus berada tu tadi. So hugging ni tak ada pun semua benda tu, tak ada elemen-elemen tu. So boleh saja. And other thing is from sharing food. So kalau you nak makan, kongsi makan ke, dia takkanlah berjangkit sebab ini bukannya COVID kan. Kalau COVID, yes, dia boleh merebak through udara and some things like that. So HIV virus, dia takkan merebak melalui sharing food. So you nak makan kongsi ke apa, you nak bersuap-suap ke, boleh sahaja. And also dari segi insect bites pun, kalau ada serangga macam lebah sengat you ke, you kena gigit nyamuk ke, dia takkan berjangkit dari situ. And also from toilet seat, you pergi public toilet and then tiba-tiba you takut pula orang sebelum you tiba-tiba ada HIV positif ke apa. No need lah untuk rasa macam tu sebab dia takkan berjangkit melalui situ pun. So berasalah selesa untuk gunakan public toilet. And then dia juga tidak akan terinfeksi melalui bermandi bersama-sama. So if let's say pasangan yang non and also PL-HIV nak mandi sesama pun boleh saja, dia takkan infect daripada situ. And from bersin and batuk pun tidak juga. Okay, and also the last one is through sweat. So kalau you tersentuh peluh dia ke ataupun dia dah lap peluh dia guna kain ke after jogging and you tersentuh, you takkan dapat ataupun berjangkit dari situ. So the next slide is the one yang tiba-tiba I terjam. So tadi I dah terangkan part ni kan, so I just rumuskan lagi sekali. So from here kita nampak dari atas tu adalah yang mana with high concentration lah. So the highest concentration is from blood, di mana HIV tu paling tinggi konsentrasi kat situ. And then to the lowest part is at the breast milk. Okay, this one also important part lah, know your risk. Okay, ketahui risiko anda. So dari yang ke kiri ni adalah yang paling rendah risiko and to the kanan adalah kepada yang paling tinggi risiko. So kat paling kiri sekali we can see the oral sex or oral sex which is yang memberi ataupun giving or receiving. Giving lah. So oral sex ni yang bagi mereka yang giving ataupun menerima, oral sex adalah risiko dia rendah. So oral sex ni termasuklah like blowjob ke, handjob and so on. So risiko untuk oral sex adalah rendah. And then after the oral sex kita boleh nampak memberi seks vaginal. Memberi seks vaginal ni for heterosexual is the man lah, antara lelaki dengan wanita. The lelaki is the one yang memberi. So memberi ni dia punya risiko adalah rendah. And then after the insertive vaginal sex, ketiga risiko yang terendah adalah memberi seks anal ataupun insertive anal sex. This one is if let's say in the like for the PLU life, the insertive will be the top lah, and also the insertive will be the insertive will be the top and the receptive will be the bottom. So from here we can see tiga-tiga dekat paling kiri sekali tu ataupun kedua-dua paling kiri sekali tu adalah mereka yang memberi. So untuk kita rumuskan, yang memberi sentiasa berisiko rendah berbanding yang sebelah kanan tu yang menerima. So kita boleh tengok kat sini, beralih ke kanan, mereka yang menerima seks ataupun vaginal ataupun golongan wanita adalah antara mereka yang golongan berisiko tinggi terhadap jangkitan HIV. And then after the vaginal is the anal sex lah, ataupun the bottom ataupun wanita yang buat seks melalui anal, mereka juga adalah golongan yang berisiko tinggi untuk dapat jangkitan HIV. And also the last one, golongan yang paling berisiko tinggi adalah mereka yang kongsi needle. Of course lah, kongsi needle tadi kita dah sebutkan kenapa kongsi needle paling tinggi, sebab confirm dia dah tersentuh darah orang tu, dia cocok dah tersentuh darah orang tu, and then cocok pula kena darah orang ni. So that's why paling tinggi concentration. And again, to rumuskan, the one yang menerima sentiasa tinggi, and one of the reason why golongan yang menerima ni kita paling tinggi adalah kerana dia ada satu risiko di mana it can be in term of this risiko di mana bila seseorang tu ada luka ke kan, bila having sex kadang kita tak pasal ada luka sebab kering ke. So bila ada luka tu and then you buat pula seks yang tidak selamat, you tak pakai kondom and then you pancut dalam. So bila the come from, if let's say the top ataupun lelaki tu adalah PLHIV and not UVL ataupun belum sampai undetectable, yang tu kita akan cerita nanti, terkena pula dekat luka-luka you. So itu yang akan naikkan lagi risiko you untuk terkena juga. So that is why kena tahu risiko anda. So golongan yang paling kanan ni kena betul-betul tahu risiko anda and make sure tak kisahlah you kanan ke kiri, always practice safe sex, okay? So tadi Raf pun dah ceritakan macam mana pakai kondom yang selamat dan juga ajar teknik-teknik cara pakai kondom. So after this, no more excuse lah kan untuk tak tahu macam mana pakai kondom betul sebab mudah je. And then we are going to talk about how to know HIV status. Okay, so untuk HIV ni tadi kita dah cakap kan pasal simptom. So HIV ni dia memang tak ada specific symptom. Okay, unlike macam Raf dah explain tadi, for syphilis you have symptoms like there will be like ulcer and also there will be like rashes, ruam, and for gonorrhea there will be like pus discharge and also feel like bila you nak kencing terasa sakit, pedih and so on. So as for HIV dia tak ada specific symptom. So that's why sometimes macam I cerita tadi, kadang-kadang orang tu tak sedar pun dia HIV sebab HIV ni dia tak ada specific symptom. Ada pun demam, something like that is common. Yang di mana penyakit lain pun dia ada common symptom yang sama, demam and so on. So sebab tu pentingnya untuk screening lah. So untuk mereka golongan yang berisiko tinggi, kita selalu suggest untuk buat HIV screening every 3 to 6 months. Okay? Sebab if let's say sesuatu berlaku, kita boleh dapatkan rawatan dengan segera. Tak adalah kita biarkan benda tu prolong lama. So sebab tu kita suggest kalau boleh kat luar sana buatlah 3 ke 6 bulan sekali. Dekat mana nak dapat, boleh je contact Raf ke, contact I ke, contact Alif ke ataupun contact mana-mana outreach worker daripada mana-mana NGO, dapatkan bantuan mereka. Jangan segan untuk contact mereka ni sebab kita orang semua ni sangat friendly, kita orang tak judgmental, kita orang takkan judge you, cakap ceramah and so on, takkan. Kita orang akan bantu you and guide you on how to get the best screening test yang very friendly. And also if let's say you are positive, kita nak benda tu berlaku, but if let's say you are positive, kita sangat happy untuk guide you and we are happy to be your friend and also guide you through the whole process. And then treatment as prevention. Okay, so treatment as prevention ni, so bila seseorang tu if let's say lah kita buat blood test tu, seseorang tu ada pula HIV, dia test ada HIV, so usually apa yang kita buat adalah the doctor lah, bukan kita lah, the doctor will give ubat lah. So the ubat is the highly antiretroviral therapy. So bila seseorang tu makan ubat tu actually akan lawan lah the virus dalam badan kita. Dia akan lawan, dia akan membasmi, dia akan bunuh and also dia akan tidurkan the virus dalam badan kita. So as you can see dalam gambar ni, there is the viral load. Viral load is actually dia bermaksud viral load tu apa? Viral load tu adalah bilangan virus HIV dalam darah kita. So as you can see before, sebelum rawatan had ni, viral load dia sangat tinggi. So banyak, penuh dalam balang ni. So after dia dah detect, after dia dah ambil rawatan, dia dah on treatment with HAART, the highly antiretroviral therapy, kita boleh nampak slowly dia dah ke arah below the level. So dia dah ke arah undetectable already. So macam mana seseorang tu nak capai ke arah undetectable, sangat penting bagi mereka yang on treatment untuk committed dengan pemakanan ubat, untuk committed dengan masa pemakanan ubat. This is very important lah. Kalau you makan pukul 9 lah setiap hari, jangan lambat 2 minit ke, jangan lambat sejam ke apa. So you memang kena committed dengan pemakanan ubat. So bila you committed dengan pemakanan ubat, in just several months, insyaAllah you akan capai, you will receive the U to you lah, U equal to you. Apa tu U equal to you? U equal to you ataupun UVL. Bila seseorang tu dah capai UVL, seperti kita nampak lah dalam gambar rajah ni, the viral load ni sangat rendah sampai tak boleh baca, so dia akan capai UVL. U equals to U adalah di mana seseorang tu dah tak dapat detect, kita dah tak dapat detect HIV, dia bacaan viral load dalam darah tu, and then dia juga bermaksud bila seseorang tu nak berkahwin ke, nak buat anak ke, anak dia tak akan berjangkit dan isteri dia pun tak akan terinfect ataupun pasangan dia tak akan terinfect sebab dia dah sampai UVL, bermaksud dia tak akan jangkitkan virus tu ke orang lain. So, yep, that's all for my part. Next, I'm going to pass to Alif.
Okay, so hello everyone. My name is Alif. So I will touch on the topic regarding the epidemic snapshot of the HIV transmission by ethnicity in 2018. So as we can see in the slide, there are 68% of Malay population infected by the virus, whereby there are 16% Chinese infected by the virus and 8% Indian, 5% foreigners, and 4% of other races that in Malaysia. As for the foreigners, I think it's commonly known by everyone that sometimes foreigners who came to Malaysia and having sex with the local and all that stuff could be possibly infected by the virus because again they are not doing safe sex. Okay, the cumulative case kit in Malaysia in 2019, the data is in 2019, it is recorded that 88,000 people living with HIV, and there are 44,168 people on highly active retroviral therapy, while there are 6,300 new infections, and there are 2,708 related deaths. Next one is, as we can see in the graph shown in the slide, there are comparison of new HIV infections between injecting drugs user or IDU and sexual transmission on 2005 until 2018. As we can see, in 2005 until 2018, the IDU is getting lower. It's decreased drastically. This is because the government ada implement needle and shrink exchange program where kita akan approach drug users on the street or anywhere untuk bagi satu needle percuma supaya diorang tak berkongsi needle. Bila diorang tak berkongsi needle, the chances of getting infected by HIV is decreased. So, since kita nampak ada perubahan yang sangat drastik untuk IDU, kita cuba untuk gunakan teknik yang sama untuk sexual transmission. Kita cuba guna same initiative, which is kita buat free condom and lube to everyone yang reach out to us and outreach workers from most of the NGOs. And kita boleh nampak kes tu macam meningkat sedikit sahaja by 2005 to 2015 to 2018. Okay, next slide is how HIV attacks our body. Okay, the first step of the virus on how it will attack our body is it enters the bloodstream, seperti yang Loma mentioned before. Ada beberapa cara untuk dia enter our bloodstream. And then second, virus tersebut akan masuk dalam kita punya T helper cell CD4 ataupun sel darah putih. Sel darah putih ni seperti yang kita tahu dia satu sel darah putih ni seperti yang kita tahu dia merupakan pertahanan utama dalam badan kita. Sel darah putih ni apa-apa sahaja virus ataupun bakteria yang nak datang, dia adalah the first barrier yang akan serang virus ataupun bakteria tersebut. Jadi, bila virus HIV ni masuk dalam badan, dia incorporates its DNA, dia sambungkan DNA dia dalam sel DNA CD4. Kemudian, the infected cell akan start to replicate. Dia akan slowly replicate to the point yang sel tersebut terhapus disebabkan penghasilan virus yang sangat banyak. Bila dia dah semakin banyak, dia akan proses tersebut, dia akan berulang to the point yang kita punya CD4 count dalam badan ataupun bahasa mudahnya, sistem imunisasi badan kita semakin lemah. Okay, so when do PL-HIV, people living with HIV, get AIDS? Selalunya bila CD4 count dalam badan sangat rendah, which is 200 CD4 count, below 200. And bila CD4 below 200, mudah badan seorang PL-HIV sangat mudah untuk infected with opportunistic infection. What is opportunistic infection? So there are a lot of opportunistic infection, but these are the most common infection yang kita selalu nampak. The first one is tuberculosis, TB. I think everyone knows what TB is sebab sometimes orang biasa pun boleh kena TB, but bila orang yang ada HIV ataupun CD4 count dia bawah 200, bila dia kena TB, side effect dia akan lagi teruk daripada orang yang tak ada virus tu dalam badan. Okay. TB with HIV co-infection is a major public health problem, especially prevalent in developing countries. The second one is pneumocystis pneumonia ataupun PCP. It is a yeast-like fungal lung infection. It is caused by pneumocystic gyrovasi, a virus. Fungal. Next one is Kaposis sarcoma ataupun KS. It is a skin cancer caused by human herpes virus AIDS. It is notoriety as AIDS defining illness in the 1980s among homosexual men. And the fourth one is cytomegalovirus or CMV, which is a viral infection that usually affects the eye. It is caused by human herpes virus 5. And last one is candidiasis. Candidiasis ni is a fungal infection that can cause a thrush, a white filament. Dia jadi dekat mulut, tekak ataupun faraj kalau CD4 count kita sangat rendah. Or infection in the throat or vagina. Okay, next slide please. Okay. A person can get in and out of AIDS. Okay, contohnya, kalau kita seorang person living with HIV ataupun PL-HIV, kita dah sampai tahap AIDS. If we stick on to the treatment, which is kita ambil ubat yang I sebut tadi, highly active antiretroviral therapy, kita ambil setiap hari pada masa yang sama, ikut saranan doktor, kita live a healthy life, kita boleh keluar daripada AIDS. Kita boleh jadi a healthy PL-HIV and live like a normal people. Live like everyone else. Kita tak payah risau pasal kita ada masalah apa semua kan, macam I tak sihat apa semua. No. A healthy PL-HIV is just like everyone else. And then, tapi kalau kita seorang healthy PL-HIV, kita tak ambil ubat, kita skip ubat, kita live an unhealthy lifestyle, kita akan kita punya status akan kembali kepada AIDS. But this process is a process yang macam repeating. As long as kita stick on the treatment, kita ambil ubat, kita akan selamat. Okay, next one. Macam mana seorang PL HIV nak reach U equals to U yang Loma ada mention tadi, nak jadi undetectable, nak reach UVL. Usually it takes around 1 to 6 months untuk seorang PL HIV nak achieve the undetectable viral load. After that, 6 bulan kemudian dia perlu maintain undetectable viral load. Macam mana nak maintain? Macam saya mention tadilah, sentiasa ambil ubat, live a healthy lifestyle, ambil ubat pula on time, tak skip ubat. Bila kita maintain selama 6 bulan, effectively no risk, which is U equals to U. Kita dah tak boleh nak transmit virus HIV kepada kita punya sexual partner, pada bini kita ataupun suami kita, as long as kita continue treatment and maintain an undetectable viral load. Okay, kita akan meneruskan perbincangan kita kepada pre-exposure prophylaxis or famously known as PrEP. Okay, PrEP ni dia satu medicine yang most people yang ada sexually active lifestyle guna untuk, kalau macam malas nak guna kondom, you can resort to PrEP, but it's quite expensive compared to condom. PrEP ni dia medicine for people who are at a very high risk for HIV and only for those who are HIV negative. PrEP is safe and effective in preventing HIV. Daily PrEP users mampu untuk mengurangkan risiko transmisi HIV melalui seks sebanyak 90%. Tapi kena ingat, kita ambil PrEP ni untuk mengelakkan kita daripada dapat HIV, but not STI. So untuk selamat, walaupun kita ambil PrEP, still guna kondom. Sebab kita tak nak dapat STI juga. Kita nak, kalau boleh, nak elakkan daripada dua-dua ni kita dapat. So kita boleh mengurangkan risiko jangkitan seksual. Okay. For example, ada satu lagi contoh yang saya boleh beri. Contohnya suami pasangan ada HIV. It is also boleh untuk the wife untuk ambil PrEP supaya boleh mengurangkan lagi risiko jangkitan transmission tersebut. Bila kita ambil PrEP, kita ada double or triple protection. Kita pakai kondom, kita ambil PrEP, suami pun on highly active antiretroviral therapy. So macam kita ada triple protection dah. Okay, next is post-exposure prophylaxis. Okay, I think by now semua orang tahu apa itu morning after pill yang selalu digunakan untuk perempuan yang baru lepas sesi sexual activity yang without condom. So PrEP ni dia sama, dia lebih kurang, bukan sama dia lebih kurang dengan morning after pill. Cumanya morning after pill ni kita perempuan memang digunakan oleh perempuan lah. Dia guna untuk mengelakkan daripada mengandung, daripada getting pregnant. But however, PrEP digunakan untuk mencegah daripada mendapat virus HIV selepas melakukan aktiviti seksual yang tidak selamat dan tidak protected. Contohnya bila tengah sexual activity tu tak ada kondom, ataupun yang memberi tu dia tak pakai kondom, dia tarik kondom dari senyap-senyap kan, and then kantoi, boleh dapatkan PrEP dalam masa 72 jam. However, macam lagi cepat kita ambil, lagi berkesan ubat tu. And then the treatment is within 28 days dan harus di follow up dengan doktor. Treatment PrEP and PrEP ni sama je macam pengambilan ubat HAD, which is lepas kita ambil tu kita kena ambil pada masa yang sama dalam masa 30 hari sampai ubat tu habis. And then after that kita kena jumpa doktor untuk check kita punya status, and then after 3 months kita kena buat another follow up untuk kita nak make sure yang kita dah bebas daripada apa-apa jangkitan infection. Kemudian saya akan serahkan sesi ini kepada Raf.
Thank you, Alif. So basically that's the end of our slides lah. Ni slide terakhir. Alif boleh stop presenting lah. So I'm just gonna conclude our session. So thank you everyone for listening. But before we end the slides, we just want to say that kita orang ada buat testing dekat office kita orang setiap Isnin, Rabu, Jumaat dan Sabtu. Dan kita orang juga ada bagi servis buat community based testing dekat mana-mana organisation yang minta kita orang buat ke sana kalau ada ramai nak buat testing. And semua free saja testing untuk HIV dan STI. STI biasa kita orang ada city list lah. So if you want to get tested with us, boleh contact kita orang. Semua presenters kat sini tak pun boleh pergi ke social media kami dekat myclass.org, myklass.org, sama ada dekat Twitter, Instagram atau Facebook. So tu saja daripada kita orang. So thank you everyone.
Sorry. Okay, so thank you. Thank you. So are you guys done? Do you have anything else to say?
Itu saja. Betul. Like for now, that's all that we have to say. I think we've said a lot already about HIV. But we do welcome any questions from anyone.
Yeah. Okay. So I think that is the end. No. I think from class part, I think that is the end. So we're gonna move forward on the questions from our audience lah. Okay, so I'm gonna check first. If we have any. Okay, yeah. So we have actually 3 questions. Do you want me to read the question and then you answer, or do you want me to read all of the question and then the?
I think it'll be better if we have the questions one by one, so we can focus on each question.
Am I having a problem with my internet? Hello? Hello?
Yes, I did hear you.
Okay, sorry. Because
Hello.
Gambar saya lagging sikit tadi.
Oh, tak nampak gambar you.
Nampak
Tak nampak.
Gigih
Okay, sekarang nampak. Sekarang nampak.
Okay, so we have 3 questions actually. So do you prefer we move one by one, like saya baca, Encik jawab, ataupun kita just saya baca sekali harung je, Encik akan jawab?
Kalau boleh satu-satu.
Which one do you prefer? Satu persatu. Okay, so okay, so the first question is it's about the vaccine for HIV. The researchers about the HIV vaccine. So during the COVID-19 era, so there are often talk about vaccine, and there is talks about finding the vaccine for HIV, if not mistaken. And the feedbacks from it comes with different views and opinion within the communities. So do you think the research, the finding of the vaccine is making people feeling more relaxed on the precautions that they are supposed to take? Do you think that people are becoming like, it's okay, jom je? Do you understand? Because then we have vaccine to treat us. Yeah. So if you think that people are gonna take HIV lightly, what advice could you give, or just to share with us so that we can create a better awareness for this group of people yang rasa macam unsafe sex, unprotected sex is okay, HIV is okay, yeah. So that is the first.
In my opinion, vaccines are very effective. Vaccines are super helpful in dealing with an infection like a pandemic. Macam COVID kan, bila lepas vaccines are introduced, for example in New York, lepas vaccines introduced in New York, like the cases went down drastically. So vaccines are very effective in helping people, but at the same time, when people get vaccine, like you said just now, people get a bit complacent. Diorang rasa tak bahaya dah nak keluar, and they feel very free. So that's quite dangerous too, because vaccine doesn't give full protection, and not everyone takes the vaccine. Some people, they are afraid of the vaccine. Some people, they are anti-vaxxers. So even with the vaccine in place, it's very important to maintain SOP. So I guess the SOP for HIV is to practice safe sex, whereas the SOP for COVID, is physical distancing, wash your hands. So SOPs for any viruses, it should still take in place after vaccines are introduced, because even with the vaccine, there is still risk, and there are risks to other people. So do protect yourself and other people by still maintaining the SOP.
Okay, yeah, that is. I also agree with that, because even with the COVID-19 vaccine, we still have precautions, right, to take. Okay, so the next question, the next question is religion related. It's about the point of view of people. You know how people will, when people are being diagnosed with HIV, and there are certain stigmas, there are certain perception of people, the communities towards them. So for this affected group, the ones that are being scrutinized by these people, what advice can you give for the patients, and then for the peoples, the communities, our communities, on this, how to give a better perceptions lah.
So I just want to make sure, and just want to be clear with the question. Right? So you're asking me like, how, I mean, like some people, they are more at risk for getting HIV and STI, and they're usually discriminated. So what was that question actually? Is it the perception of people on them, or how?
I think saya rasa lah, I think it's more about how we can handle this other communities around us. How can we change their perception? Because like kita tahu sendiri kan, like certain agama, like people yang betul-betul agama kuat ni, diorang akan pandang serong lah for the people with HIV, AIDS and anything. So for you, how can we help them to see that it is not everything is about berkaitan dengan seks apa kan? So how can we change that perception from the within our community?
That's a very good question, because I think like that's one of the major problems we face in trying to help our clients, because a lot of them face stigma and discrimination from society. And sometimes because of the stigma and discrimination, some patients, they have self-stigma. They feel bad about what they did. Maybe dia orang rasa bersalah sebab dia orang pernah buat hubungan seks before this, because the community also views them that way. And some of them, dia orang tak ambil ubat sebab dia orang malu dengan dia sendiri. So tak ambil ubat sampai dia orang sendiri tak sihat, dapat AIDS, and then mati because of that. So like in Malaysia right now, ada 88,000 orang yang ada HIV, tapi hanya separuh je yang dapat rawatan. Dia orang tahu dia orang ada HIV, tapi dia orang tak dapat rawatan, mungkin sebab stigma diri sendiri, stigma dari masyarakat. So it's important because masyarakat kita, our communities are composed of like various races and religions. So I guess like one important thing to let everyone know is like knowledge in HIV and STI. That it happens because for some people it happens because of lifestyle choices, like they don't use condoms during sex, or they inject drugs. But also other people, like partners who get it from their partners from not knowing that they're positive, or babies that get it from their parents. So we can't say that I'm not saying that people who have sex they are in the wrong, because like everyone likes sex. So what's important, I think, is to give knowledge about HIV and STI, and then also emphasize on the fact that we don't have to, okay, when a religion deals with moral issues, that's in that religion, maybe it's justified for them. But also in every religion, there's a responsibility to take care of humanity. So I feel like all of us should put humanity first in dealing with this endemic, this pandemic. Yeah, it's a very hard question to answer.
Yeah. For me also, it's a hard thing trying. Sebab masyarakat, we all have different thoughts, different cara lah, and then to change everyone is
Macam saya sendiri, saya rasa macam semua orang ada jihad masing-masing. Tu antara dia dengan Tuhan. Dan orang yang bekerja dalam bidang ni buat fardu kifayah sebab kita nak tolong dia dari segi kesihatan awam. So yeah, niat tu penting juga.
Yeah. Okay. For the third question, I think saya rasa macam sama je dengan soalan kedua tadi. I think you've explained well, but I'm just gonna read it. Okay, so as we all know, this disease babies are also being affected kan sebab through birth. Okay, so however, the perception from communities is this disease only affected by sex, which we know before we argue, we already give perception. So what could the best advice could give for the community and some support words for group that are being affected by this disease? I think saya rasa macam soalan sama je kan, just a bit different. And for the mothers lah kot, untuk ibu-ibu.
So your question is like if a baby is infected with the virus or like a mother's child is infected with the virus, what can we do to help people around them? Itu soalan dia.
Wait, I think lah, saya rasa soalan dia berkait macam, I think it's the same with the second one. It's all about perceptions and discrimination. It's about people when babies are being affected by the HIV, tapi orang ingat sebab benda ni is more sex related, but tapi baby kan like tak ada apa-apa and then tapi dia kena juga. So I think this question is more towards the support advice how to handle the perception jugalah macam from the community.
Masa satu yang I think like we can do is macam tadi jugalah cakap kan, bagi knowledge. So, because orang takut dengan HIV ni sebab dia ingat macam kalau kita sentuh je boleh dapat HIV. Tapi tak, kalau kita makan guna sudu garfu yang sama semua macam berpeluk dengan dia, bercium dengan dia pun takkan dapat HIV. So I guess giving knowledge to them so dia orang tak ada stigma sangat terhadap HIV ni lah, mungkin dia takut dapat HIV kan. At the same time macam kita boleh bagi counselling kepada partners tu juga. So like in Malaysia untuk orang Islam, before they get married they have to get tested for HIV. And in some clinics that I've attended, ada setengah klinik tu ada macam 6-7 partner dah kahwin dah, partner dia yang negatif tu still negatif lagi. Tapi lepas kita awal-awal tu waktu lepas kita test tu, kita akan panggil partner dia buat macam family counselling lah, couple counselling. Kita explain betul-betul kat dia HIV ni apa, macam mana nak transmit, kita boleh buat anak lagi sebab virus tak akan transmit kalau dah undetectable. So I think it's the same answer as before, which is a lot of knowledge and support for the family.
Okay, I think I have a personal question as we follow up daripada soalan tadi lah. The baby yang kena HIV tu, how will the baby like grow up dengan benda ni sampai ni lah kan, like selamanya. And how actually is there any macam ni? It's like how do you help this orang yang like diorang tak bersalah but then diorang ada
beberapa cara lah. Dia macam kita boleh cegah dan kita boleh rawat. So untuk cegah tu, so contohnya ibu tu mengandung, the mother is pregnant but the mother is HIV positive. So like in Malaysia we will test every mother for HIV and syphilis. So semua ibu akan kita akan buat testing, buat ujian saringan untuk HIV dan syphilis. Dan kalau dia positif, kita akan start treatment. So kita akan start rawat. Contohnya kalau untuk ibu mengandung, kita akan start rawatan pada minggu ke-13. Yang lepas 12 minggu baru boleh buat rawatan. Sebab the first 3 months tu macam tak takut effect baby. So lepas dah 3 bulan tu boleh start ambil ubat HIV. Makan macam orang HIV lain lah. Makan ubat sekali sehari, biasanya waktu malam. Contohnya kalau dia makan waktu pukul 10, setiap malam sepanjang hayat pukul 10 dia kena makan. Kalau mengandung waktu bulan ketiga tu kena start makan ubat sampai nak bersalin. Waktu nak bersalin tu kita bagi ubat juga, tapi kita bagi ubat inject dalam darah supaya banyak lagi ubat dalam darah. Lepas tu bila bersalin kita tak nak buat normal delivery. Sebab kalau dia lalu ikut laluan faraj, nanti risiko untuk dapat HIV lagi tinggi. So kita akan buat C-section. Bila C-section, risiko untuk baby dapat HIV sangat kurang. Dan lagi kalau mak tu dah bagi ubat. And lepas baby tu dilahirkan, kita akan bagi ubat kat baby tu selama sebulan. And biasanya kalau mak dia ambil ubat sebelum bersalin, waktu bersalin kita buat C-section, and lepas tu bagi ubat sebulan untuk baby lepas lahir tu, baby tu memang HIV negatif for life. Dia tak dapat apa-apa. Tapi untuk yang kita tak buat semua benda ni, baby tu akan jadi positif for life. So lahir dah positif, sepanjang hayat akan positif. Setiap hari kena makan ubat, tak boleh tinggal. Macam orang yang ada HIV lain juga. So makan ubat sekali sehari, selagi dia tak tinggal ubat tu, selagi tu dia sihat lah. And then ubat HIV ni dia ada untuk setengah orang dia ada efek pada buah pinggang dengan hati. Sebab buah pinggang dengan hati ni dia akan tapis semua jenis ubat. So semua jenis ubat kita kena monitor lah buah pinggang dengan hati. So dia kena hidup cara hidup sihat, pemakanan kena elok, kena physical exercise. So dia pun kena jaga dia punya kesihatan juga. Tapi boleh hidup untuk jangka masa yang lama. Macam dulu kita tak ada ubat sangat, ubat pun tak canggih. Tapi sekarang ubat tu kalau makan setiap hari, jangka hayat hampir sama dengan orang yang tak ada HIV.
Oh, okay. Saya baru tahu informasi tu.
Saya pun baru-baru juga tahu 2-3 years back, macam terkejut juga kan. Sebab kita dengar kalau orang dapat HIV macam death sentence. Tapi tak sama sekarang ubat canggih.
Oh, ya tu. So the babies like they will lead a normal life lah kan kiranya. So
dia orang kena disiplin ubat tu je. Tu beza.
Okay. So tu je lah soalan yang ada, and I don't have any more questions. And it's almost seminit je dah lagi, 9:30. Okay, so ladies and gentlemen, finally we come to the end part of our forum today. So thank you once again to our class speakers, Encik Rafi, Encik Paloma, and Encik Alif for your active participation, and for our audience that have joined us from the start until the end, thank you. It is our honor and pleasure to have you guys tonight for this sharing session with us, and we do hope you have gained knowledge and has been inspired with today's forum for our audience. And before I end, I apologize for any mistake from my part, if for any disturbance or if I say anyone's name wrong. So I apologize for that, and thank you for tonight. And my name is Juris Nur Hafiza. I'm wishing you all have a great night on ahead. And this is Hall Aspire, a place for satisfy your taste for knowledge. Thank you all. Thank you, our speakers.
Thank you so much for having us.
Thank you so much for having us.
Thank you.